If you could just sort of flush out, and perhaps Governor, you as well, how big of a concern is this? We've all been at home for several weeks now, and people are starting to really go stir crazy, and understandably so. How big of an issue is this? What kind of a stigma may people be facing in terms of feeling embarrassed to ask for help that they've never had a mental health issue before? And I guess that's it.
Judy, may I start and then jump in? Is that okay? I think the admissions rate, tell me, is it not mathematical? Because we have hospitalizations and folks who have left the system. I know you speak to it qualitatively, but I believe this is math, and if we have the math, I'll defer to the boss here to my right as to whether or not it makes sense to put those up. But Judy, you'll come back on that. Mental health, and again, Judy started with this today, not by accident. This is something that we've spoken to and is a concern. I was asked last night about liquor stores, and the fact of the matter of addiction and dependency is a reality. I think I said this, I can't recall, 10 days or 2 weeks ago, that there's an extraordinary thing happening that is still happening. Overwhelmingly, and there's an extraordinary irony to this, that as we isolate ourselves, as we stay away from each other, there is a coming together. We're all in this to win this war sort of spirit, and you can see the map reflecting that. So it's a very sort of against expectation, all for one, all in this together. And that's the overwhelming reality. But we've also said that that's not everybody. Folks who suffer from mental health challenges, depression, addictions, other suicidal tendencies, that some folks clearly get left behind by this. And the longer the clock, as a non-medical expert, the longer the clock, the bigger the concern as it relates to that. And therefore, it's no coincidence that Judy started her remarks today focused on mental health, because it's something that she, along with Carol Johnson and our Department of Human Services, all of us are very focused on. And that's why we've stood up hotlines. It's why we've got unusual outreaches as it relates to this. And so with Judy on both the numbers in terms of the admissions and ER, I actually don't know the answer myself to the ER question, but also any more color on the mental health piece.
Sure. Well, first on the mental health piece, you point out really, correctly that everybody can do something for 2 weeks. When it gets to be 4 weeks or 6 weeks, things do get a little stressful. I'm struck by the Commissioner of Children and Families and the